What's the best treatment for carpal tunnel syndrome? Carpal tunnel syndrome affects the tendons and the nerve that runs through your wrist. And if you have carpal tunnel syndrome, it can be mildly annoying, or it can keep you from sleeping at night or doing your work during the day. So in this video, I'm going to explain what causes carpal tunnel syndrome and what treatments you can use to get rid of it so you can sleep better and do the things that you need and want to do during the day. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So what exactly is carpal tunnel syndrome? The carpal tunnel is a tunnel that runs through your wrist, through the carpal bones or the wrist bones. And there's 8 carpal bones in your wrist, but the carpal tunnel is formed by 4 of them that form a U shape if you're looking at it from this direction. And through that U-shaped tunnel runs the median nerve that goes to your first 3 fingers and the flexor tendons that help you squeeze and grip with your fingers and with your thumb. And then over top of that tunnel, the roof of the tunnel, there's a ligament called the transverse carpal ligament. And that basically helps bend the U up, pull the 2 ends of the U together, and it forms an enclosed space. Now, when there's too much pressure inside that space, either from swelling, such as if you're pregnant, you may have swelling in your hands and feet, and that can cause swelling inside the tunnel. Or if you've inflamed your wrist in some sort of an injury, that can cause swelling inside the tunnel. But the most common cause of carpal tunnel syndrome is overuse, repetitive use of your hands, where you're doing things like typing or doing a manual labor job, playing piano or another musical instrument like a string instrument. When you're overusing your hands, that's the most common cause of carpal tunnel syndrome. And what happens is that either that space gets too narrow from muscles being too stiff, or the swelling inside the tunnel. Now, additionally, there are some people who have a little artery that runs through that tunnel. It's not a big percentage of people, but that can take up some extra space in the tunnel as well. So what do you do if you have carpal tunnel syndrome? What are the treatment options for it? And there are conservative treatment options, which are largely medications, bracing, and physical therapy. And then there are more aggressive treatment options like getting injections in it or ultimately getting carpal tunnel surgery. So if you'd like to avoid carpal tunnel surgery, those are the tips that we're going to be discussing in this video. Now, the medications typically used for carpal tunnel syndrome, they're anti-inflammatories like NSAIDs, non-steroidal anti-inflammatory drugs, or steroid drugs, which both classes of those are strong anti-inflammatories. They can help if you have some inflammation that's taking up extra space inside that tunnel. But if the problem is more of an overuse injury, that you're moving your wrist in awkward positions, or you're creating too much compression, say from resting your wrist on the keyboard, that's not necessarily going to help that type of carpal tunnel syndrome. And at More for Life, we like dealing things without relying on medications anyway. So in the rest of this, I'm going to discuss braces and stretching and exercises and physical therapy treatments that can help carpal tunnel syndrome. So the most common use of a brace for carpal tunnel syndrome is at nighttime, particularly if you sleep in the fetal position, you lay with your arms curled up or hands curled up like that. You can't really control what you do at nighttime. And so wearing wrist splints or wrist brace at nighttime is really good for carpal tunnel syndrome because they essentially keep your wrist in a neutral position, not too far bent that way and not too far bent that way. But this is the big problem at night, where people tend to curl their wrists up too much. So wearing a wrist splint can help keep you in a neutral position and help prevent you from pinching the median nerve inside the carpal tunnel. Now, what do you look for in a carpal tunnel brace? Well, essentially, they're very simple things. Anything that's somewhat firm, it should be made of a material that's not going to bend, not like just a wraparound elastic. It should have some density to it. Usually they're reinforced on the palmar side here. They've got some sort of a plate or plastic there that will help prevent you from bending your wrist down. And then they should have some Velcro straps that help secure it around your wrist so it doesn't fall off at night. Other than that, you don't need an incredibly expensive or complex brace for carpal tunnel syndrome. It's just basically to help keep your wrist in a neutral position. Now, additionally, you can wear those braces during the day, especially if you're doing a manual labor job or lifting heavy things with your arms or doing something repetitive like typing with your hands, where you're at risk for overuse. And if you keep your wrists in a neutral position when you're doing those things, you don't type with your hands up like that, it'll help prevent carpal tunnel syndrome as you're doing those repetitive tasks. So that's bracing. Now, what about exercises for carpal tunnel syndrome? Well, if you look online and Google it, you're probably going to see things like doing stretches like this, when you pull your wrist back that way, and doing stretches like that, and squeezing a stress ball or squeezing some therapy, and then opening your hand up like that. And those are okay exercises, but the ones that probably you want to avoid are going down this way. And the reason for that is that's exactly what causes carpal tunnel syndrome a lot of times, is bringing your wrist too far down and compressing the space inside that carpal tunnel. It kind of puts the median nerve, it kind of kinks it where you're bent right there. And that's a problem that it's actually a test for carpal tunnel syndrome. If you put someone in a position like that and it brings on symptoms, that confirms the diagnosis or is one indicator that you might have carpal tunnel syndrome. So you want to avoid stretching down that way for most people. The rare exception would be if you have a lot of stiffness in the forearm and you can't get very far down. If you can do that and get your hand to almost a 90-degree angle, you probably don't need to be stretching your wrist down that way. Now, stretching your wrist up the other way is good, but when you pull your fingers up like that, you kind of tension the median nerve, you tension your finger flexors, and that can irritate symptoms sometimes, especially if you have a really irritable case of carpal tunnel syndrome. So for a lot of people, stretching up this way is good, but you may want to pull from your hand instead of pulling from the fingers so that you're stretching the wrist. You're getting the wrist to bend back that way and opening up the space in the carpal tunnel, but you're not putting the tendons and the nerve on stretch by having your fingers pulled back like that. Now, there are other options that are really helpful for stretching your wrist if you have carpal tunnel syndrome, and they also kind of help mobilize the wrist bones or the carpal bones. If you take your hand and you put it on a table or a flat surface like this and lean over top of it, and then put your other hand over top like that, now you kind of use the top hand, this one, as a fulcrum, and you help to move at the wrist. This is a lot more comfortable. It helps get those little tiny carpal bones that form the carpal tunnel to move a little bit better, and it doesn't put quite so much tension on your fingers as pulling it back like that. So that's one suggestion of a way to stretch your wrist flexor muscles if you do have carpal tunnel syndrome. Now, the squeezing a ball, that's okay, but again, it's kind of a repetitive task. It uses your finger flexors, and getting those flexors moving is good, but you don't want to overdo it. You don't want to overuse the squeezing. The opening your palm up one, I like that quite a lot. That helps open up the space of your carpal tunnel, spreading your fingers out and kind of splaying as much as you can, and even manually putting a little bit of pressure over there to stretch that ligament, that transverse carpal ligament that runs over the carpal tunnel. So opening up that way. Now, another exercise you can do for carpal tunnel syndrome is nerve glides, particularly the median nerve that runs from your neck, down your arm, into your hand, and into these first three fingers. The median nerve is the primary structure that's affected in carpal tunnel syndrome. And so if you're doing this type of exercise, it gets the median nerve running throughout the whole path, from your neck all the way down to your shoulder. You can get out like this comfortably. You can even move your neck away from it a little bit to get a little bit more tension or stretch on that median nerve. And this shouldn't be an incredibly painful exercise. You should just do it in the range that feels comfortable. So you're coming to your shoulder, extending the elbow, palm up, wrist, fingers, and thumb back. And just moving in the range that feels comfortable. So you get some blood flow and oxygen to the median nerve. I've said this before, but nerves need three things to be healthy. They need space to move, so they can't be compressed. They need movement, so they need to glide back and forth through the tissues that they run through. And they need blood flow. And when you move like this, you get movement and blood flow. And then when you do stretches like the stretch I showed this way, that helps open up the space, or when you stretch out this way, that helps open up the space in the carpal tunnel so that you're not getting that median nerve compressed. So what are some other treatments that you can use for carpal tunnel syndrome? Well, if you're looking to avoid surgical treatment options, you definitely need to address the root cause. That just doing exercises or just wearing braces isn't going to be a permanent fix for carpal tunnel syndrome, because you're just going to keep doing the repetitive activities that caused it in the first place. So using proper hand positioning when you're typing, not having your arms up too much like that, trying to keep a fairly neutral wrist position with or without wrist braces, using an ergonomic keyboard where the keys are slightly angled that way instead of where your arms are kind of awkwardly positioned like that. That can also help. It's also important to use a chair with good armrests where you can relax your arms. That'll actually help take some tension off of your neck, because a lot of carpal tunnel syndrome can be caused or affected by your neck. They've done EMG studies or nerve conduction tests, studies where they'll test people who have symptoms in their hands, and almost 50% it's coming from their neck. In about 20% or so, it comes from carpal tunnel syndrome, and in about 25, 26%, I think, it's coming from a combination of the two. So if you do have carpal tunnel syndrome or symptoms of carpal tunnel syndrome, you want to check out your neck and make sure that that's not either the whole source of the problem or at least a contributing factor. And if you do have a problem in your neck that's causing radiating symptoms down into your hand, I've got another video that I'll link to that shows you stretches and exercises you can use for a pinched nerve in your neck to help relieve symptoms in your hand. So what other treatment options are available for carpal tunnel syndrome? Well, physical therapy is another great treatment option. That physical therapy, at least the way we do it here at More for Life, is much more than just doing stretches and exercises. We want to, one, help you identify the factors in your everyday life that are contributing to the problem. And we can also do some hands-on treatment like improving the mobility in the muscles in the forearm, or improving the mobility of the wrist bones or carpal bones to increase the space where the tendons and the median nerve run so that they're not getting compressed as much. And will also help rule out whether or not a neck problem is contributing to your symptoms. So if you happen to live in St. Louis and you would like some help for carpal tunnel syndrome, just feel free to reach out to us at More for Life and we'd be happy to help. And if you're watching this from somewhere else but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.